Hey guys, welcome to my anatomy and physiology video. So for the first question, what is the difference between anatomy and physiology? Well, anatomy is the study of structures and relationships between body parts, and physiology is the science of how those parts come together to function and keep the body alive. Human bodies are comprised of different types of organizations. One of the smallest organization level is an atom. If you have multiple atoms working together, then it creates cells. If you have multiple cells functioning together, then it creates tissues or muscles. And if you have multiple tissues and muscles functioning together, then it creates organs. And if you have multiple organs working together, then it creates organ systems. And if you have multiple organ systems working together, then it creates the largest overall organization level, which is the body. In anatomy, we need a distinct language so that we can communicate exactly where the problem is, which is called directional terms. As you can see here, our body is in anatomical position, which means that it's facing towards us with its palm facing up. The first plane we have is the sagittal plane that vertically cuts the body into right and left parts. Next, we have the parasagittal plane that is parallel to the sagittal plane. Then, we have the coronal plane that vertically cuts the body into front and back parts. Then we have the transverse plane that horizontally cuts the body into top and bottom parts. Next we have the axial parts of the body, which include the head, neck, and body. Then we have the appendicular parts that include the arms and legs. The way the body is positioned now, it is anterior to us. If you flip the body back, it is now posterior to us. Superior means towards the head. For example, the heart is superior to the stomach, and inferior is towards the bottom. Every body has a midline, as you can see that I drew right there. If it's towards the midline, it's called the medial, and if it's away from the midline, it's called the lateral. Proximal means towards the trunk, and distal means away from the trunk. In anatomy, we also have verbal maps for each body part. Starting from the anterior view, we have the forehead, which is also called the frons, then we have the skull, which is also called the cranium, then we have the eyes, which is also called the oculus, then we have the face, which is called facies, then we have the ears, which is iris, then we have the nose, which is called nasus, then we have the mouth, which is called oris, then we have the neck, which is called cervices, then we have the chin, which is called mentis, then we have the chest, which is called the thorax, then we have the armpits, which is axilla, then we have the breast, which is called mamma, then we have the arms, which is called a branchium. Then we have the stomach, which is called the abdomen. Then we have the front of the elbow, which is called the antecubital. Then we have the forearm, which is called the antebranchium. Then we have the belly button, which is called the umbilicus. Then we have the hip, which is also called the corsac. Then we have the wrist, which is called the carpus. Then we have the pelvic, which is called the pelvis. Then we have the thumb, which is called the pollex. Then we have the palm, which is also called palma. Then we have the fingers, which is also called digits. Then we have the groin, which is also called the inguine. Then we have the public, which is also called the pubis. And then we have the thighs, which is also called the femur. Then we have the kneecaps, which is also called the patella. Then we have the leg, which is called the crus. Then we have the ankle, which is called the tarcus. And then we have the toes, which is called the digits. Then we have the great toe, which is called the hallux. Now moving on to the posterior view, we have the head, which is called the cephalon. Then we have the neck, which is called the cervices. Then we have the shoulders, which is the acromion. Then we have the back, which is called the dorsum. Then we have the arms, which is called the ambranchium. Then we have the back of the elbow, which is called the acranium. Then we have the loin, which is called the lumbar. Then we have the sacral, which is called the sacrum. Then we have the forearms that are called the antebranchium. Then we have the hand that is also called the mantis. Then we have the buttocks, which is called the gluteus. And then we have the thighs, which is called the femur. And then we have the back of the knee, which is called the popliteus. Then we have the calf, which is called the sura. Then we have the heel of the foot that is also called the calcaneus. And then we have the sole of the foot, which is called the planta. And each of these body parts that I've previously stated are a part of different types of cavities. The first cavity is the dorsal body cavity, which include the cranial cavity and the vertebrae canal. In the cranial cavity, it includes the brain, and the vertebrae canal include the spinal cord. The next major body cavity is the ventricle body cavity, which include the thoracic cavity and the abdominal pelvic cavity. In the thoracic cavity, the organs included are the heart and the lung. Inside the abdominal pelvic cavity, there is the abdominal cavity and the pelvic cavity. In the abdominal cavity, the organs included are the digestive organs, spleen, and kidneys. In the pelvic cavity, the organs included are the bladder and reproductive organs. Now let's talk about regions. On the top right region, we have the right hypochondriac region, and then we have the epigastric region on the top middle. Then we have the left hypochondriac region on the top left. Then when we move into the middle row, on the right side we have the right lumbar region, in the middle we have the umbilical region, and then to the left we have the left lumbar region. On the final row, on the right side we have the right iliac region. On the bottom middle we have the hypogastric region. And finally, on the bottom left corner we have the left iliac region. Last but not least, we have quadrants. First we have the right upper quadrant, then we have the left upper quadrant, and then we have the right lower quadrant, and then we have the left lower quadrant. Anatomy is related to chemistry and bio as well. In chemistry, we're allowed to fully understand the functions of the human body, and biology is the foundation of human life. We also use anatomy in everyday life. For instance, whenever you go to the doctors, they may use these directional terms or verbal maps to communicate exactly what the problem is. Thank you for watching my video, and I hope you have a good day. Bye!